For a stroke occurs when blood flow stops to a part of the brain, which leads to damage to the brain tissue. Sital occurs due to the blockage of the arteries that nourish the brain and can be caused by many reasons, including blood clots. This occurs when a blood clot in the artery is formed that prevent blood flow to the brain. The blood clot is usually as a result of abnormality, and this can occur due to clotting disorders or the accumulation of fats and sediments inside the arteries. Arterial blockage. The arteries can be dominated by the accumulation of fats and sediments on their walls, and this is called atherosclerosis. When the blockage occurs, the blood flow to the brain stops, which leads to a blood clot. Blessing. In some cases, bleeding in the brain occurs as a result of an explosion or tear in the arteries. This can happen due to high blood pressure or arterial abnormalities. To prevent stroke, the following procedures can be followed: maintaining appropriate blood pressure. Blood pressure should be monitored and seek to maintain its values within the correct range. If you have a problem with high blood pressure, you should follow your doctor's advice and take prescribed medications to control blood pressure. Maintaining healthy cholesterol levels. A healthy diet that contains low amounts of saturated fat and cholesterol should be eaten. Smoking and physical activity should be abstained regularly. Using anti-clots. In some cases, doctors can prescribe anti-clots such as aspirin or warfarin for people with high risk of blood clot. Prevention of cardiac arrest. You must seek to prevent heart attack as well, as stroke and heart attack can have common causes. The following measures can be taken to prevent heart attack and thus stroke. Maintaining a healthy lifestyle. It is recommended to follow a healthy diet that includes eating fruits, vegetables, and whole grains, and avoiding foods with high saturated fats and cholesterol. Physical activity must also be practiced and refrain from smoking. Monitoring cholesterol levels. Cholesterol levels must be examined regularly, and medical directives to maintain cholesterol levels in the healthy domain. Blood pressure monitoring. Blood pressure should be measured regularly and take the necessary measures to maintain blood pressure at health levels. Diabetes control. If you have diabetes, blood sugar levels should be monitored and a doctor's advice is followed to keep sugar levels in the healthy domain. Reducing stress and psychological pressure management. Constant tension and psychological stress can increase the risk of blood clot. Action should be taken to control stress and search for ways to manage psychological pressures such as meditation or yoga. It is also important to consult a doctor to assess the risk of personal blood clots and your prevention needs, as the doctor can direct you based on your condition and specific risk factors that you may have.